Hi, welcome to the McIver method. My name is Megan and I will be your instructor for today. So let's get right to it. Today's topic is going to be medication administration, specifically pills. So let's talk about how to give a pill. Let's say that we are going to give 50 milligrams of metoprolol. Okay, 50 milligrams of metoprolol can come in a pill form. All right, the first question that you need to ask yourself when you are about to administer meds to a patient is, can your patient swallow pills? If the answer is yes, you'll come over here. You will give the med whole, thin. This is normally for easy rehab patients. If the answer is no, or if you have any question of whether or not they can swallow a pill, your next thing is to ask, has your patient had a swallow eval, short for evaluation. Now, dietary usually does swallow evaluations, and they can come out with a diagnosis for what they're having problems with and come out with a dietary plan. And along this list of things they can come out with is what I like to call like a swallowing continuum. And over here you have patients who take the exam, they swallow pills easily, no problem. And then you have patients over here that are very difficult. Okay, so let's start with easy. Here, these patients are going to be whole, thin. Now, what does this mean? This means that they can take whole pills with thin liquids. Thin liquids are water, juice, anything like that. Most of us are whole pills with thin liquids. You'll take a couple Tylenol for your headache, swallow it down with some water, no problems at all. Next, as we get a little bit more difficult, you are going to have whole with applesauce. Now, this is just as it sounds. You're going to have a whole pill, mix it with some applesauce, spoon it out, and give it to your patient. Next on the continuum is whole and nectar. You're going to see this a lot. This means whole pills with nectar thickened liquids. Now, depending upon what institution you are with, nectar thick liquids will come in a package that you can mix with water, juice, and it will thicken up the liquid to a nectar consistency. We say nectar consistency is about milkshake consistency. You'll give the patient their pill, you will give them their nectar thick liquids, and they should swallow with moderate difficulty. All right, next on the continuum is whole and honey. This is whole pills with honey thickened liquids. Honey thickened liquids are the consistency of honey. It's much thicker. And these patients will get their little package of thickener that you can mix in a juice or water. And then you'll give them the pill, and then they will swallow their honey thickened liquids with it. I will say that lots of institutions now have pre-made nectar and honey thickened liquids just because they're becoming so common with swallow evaluations. And if they cannot swallow whole with honey, next on the list is crushed with the favorite applesauce. And this means that you're going to take the pill, put it in your little pill crusher, mix it in with about a teaspoon of applesauce, maybe 2 teaspoons if it's got a very bitter taste, which most medications do. Spoon it back out and give it to your patient. Make sure you do not mix it with a excess amount of applesauce, because then you're going to be feeding the entire amount of applesauce to patients and they get full quickly. And the last place on this continuum is at the end, where we have the famous NPO. NPO is nothing by mouth. And when they took the swallow evaluation, they likely had liquid put in their mouth, usually water, and they started choking on it and possibly aspirated. So they have been deemed by dietary that nothing can go, no medication can go through the mouth. It needs to go via other channels until they have secured the airway and can stabilize this patient. So this is what we call the swallowing continuum. You're going to see the word continuum a lot in nursing, so get used to it. Try to break it down, try to make it easy.